Okay, hi, I am Amy Grosso. I'm the Director of Behavioral Health Services for Round Rock ISD, and this is the first of a few series of talking to different mental health professionals in our community to try to bring awareness since it is Mental Health Awareness Month. Our first person that we are interviewing today is Jenna Fleming. She is the owner and a counselor for Georgetown Child and Family Counseling. Thank you, Jenna, for being with us. And if you can just talk a little bit about how you serve as a mental health professional in our community.
Absolutely. Thank you. Thank you for inviting me. I am a licensed professional counselor, and that's the avenue that I serve right now. I have my background was actually there in Round Rock ISD as a school counselor for about 10 years, where I got to serve students, and now what we get to do in our office, we have a combination of licensed professional counselors and licensed marriage and family therapists. And there's a little bit of nuances on the different licensures, but we all pretty much do about the same thing. So what we do is we serve people in an outpatient setting in our community. And what that means is that we are an office that doesn't serve people who stay overnight. So we're not a hospital type setting. And we also are not a higher intensity setting. So on average, we see people once a week, sometimes twice a month. And we work on things with people who are struggling with anxiety, depression, general stress or transitions in their life. And a lot of times parents who are struggling with managing family life and parenting and behavioral things, or just, I don't know what to do. I learned that my child started acting in this way, and it feels really scary and big. Maybe it's cutting, or maybe it's tummy troubles that seem like they're anxiety related. Those are the kinds of issues that are pretty common to what we serve.
When I love what you said about somebody that knows that there's anxiety or depression, but also just this, I don't know what's going on, but I know there's something there, that is somebody that could reach out also.
Yes, absolutely. So, you know, one of the things that I think a lot of us in mental health, and I think we all have our own personal stories growing up, but my mother struggled with a lot of her own depression in her life, but going to see a counselor, there was a lot of stigma around that, and a lot of mystery and unknown about what a counselor does, or are they going to be intrusive in my life, and where on earth would you even where would you even begin? Kind of growing into my own self and learning through my own journey, the power of counseling can be really tremendous. And so part of our actually the we have a mission and our vision. So our vision has three pillars. It's to increase the accessibility, the approachability, and the quality of mental health services in our community. And a lot of it is that it doesn't feel approachable. I don't know where to start, or a lot of times people will call around and they won't get calls back, or they feel like this person said they don't work with my issue. I don't know where to go. And that is a hard pill for me to swallow, because I can understand how that impacts people and creates another barrier for help. So our goal is to help people get connected with the right help, whether it's in our office or not in our office, or at their school, or wherever it is, because it's when you're in the middle of it, it's all confusing and overwhelming. And so that is a really common thing for people not.
Yeah, and with that, so say I'm a parent and I've called because I want an appointment for my child and I've scheduled an appointment. Can you walk me through what a first session would look like for me and my child?
Yeah, absolutely. So in our office, what happens is you call a number. There's like 14, I think 14 or 15 of us. I think there's 15 total, 14 therapists. So you call a number, And Shannon is the lady who you speak with. And Shannon listens to the issue and she's figuring out, hey, what is it that you're looking for? Do we cover the insurance if you're wanting to use insurance? It is your plan. Are there other options? Do we have counselors that serve developmentally the issue? Because it's different working with a 5-year-old than it is a 25-year-old. And then also training wise with what we think will probably be what you're gonna be needing some support with. So that's sort of the first step. Now, with a lot of counselors who practice similar to me, they're on their own. And so you'll call that number and you'll talk to the counselor, but it's going to be something similar. The first step is calling, contacting, and then filtering out to try to get a match. That's the first step. And then you'll get scheduled for an appointment. And that very first appointment, when you see a counselor, is called the intake appointment. It's different with everyone, but in our office, the way I describe the intake appointment is the whole purpose is really to get to know you, the client, the person who's there for help and support. I want to kind of jokingly say I'm really nosy. I want to know what's bothering you, what triggered you to call, what are you looking for in your life to get better. And then the counselor is probably going to ask a lot of other questions that have to do about your history. And so it's what's going on right now. What's the history of what happened? And then we shift focus to what do you want to change in the future? And what that usually is that what do I want to see changed? That becomes the first step in setting the counseling goal. And that's really what counseling is. It's we want to see something change in the future for the better. And that's the goal that we're working toward. So the whole counseling process or the treatment plan is the technical term for that, is working toward headed in the direction of that goal. And yeah.
You talking about the process instead, one counseling session isn't going to cure the whole world, right? Like that it is a process that does take time. Like it's an investment and a belief and a trust in the process.
Yes. Yeah. And it's like it's tricky because you can't really prescribe a certain number of how many sessions, how frequent, or how long it will take. So it's really unique to each person, their situation, the complexity, and sometimes new goals pop up. But in general, I kind of will use a comparison. At least maybe this is just with me because I am very like it doesn't come natural for me to want to get physically in shape. It just doesn't. I need sometimes someone, a coach or someone to tell me, okay, Jenna, this is what you're going to do. And I want you to practice it. And then I want you to come back again and we're going to practice it again. And then you're going to get stronger. And then you start to pick up the technique, you start to pick up the habit, you start to get feeling physically stronger and more in shape. And that's not terribly far off. I'm oversimplifying it. Like, to be fair, if any professionals are, I'm really oversimplifying the process, but it's not that far different than the idea of going to a personal trainer or something like that. It's not a once or twice type of visit. We usually what we do in our office is we call it revisiting the treatment plan, and we do that about every 4 appointments. And what we're doing is we're just sort of checking in, revisiting the goal. How are we doing? Are we headed in the right direction? And then is our frequency of appointments still appropriate? Do we need to end? Do we need to continue? Those kinds of things. So, and a counselor would be doing that, and any counselor is trained to do that. At least stated, this is where I'm trained.
Yeah, well, and saying just that it's an ongoing discussion. It's not like there's no end in sight. That a counseling relationship, it is a relationship, and it's a two-way street. I do know a lot of times when I've talked to parents at the district and they've asked about their child going to see a counselor outside of the district and things, they're very concerned that their child will talk with the counselor and they're not going to get to know everything that's discussed.
Yeah,
you talk a little bit about that, because I think there's a lot of fear for parents while there needs to be that trust developed with the counselor?
Sure, sure. And I'm going to speak to my office because each professional is very different in how they approach this. And my background being a school counselor brings a different lens than somebody who doesn't have that background. And the way we approach it is the first appointment includes parents. A lot of times with older children, teenagers, they want to come in and teenagers often want their autonomy. So they want a lot of their privacy. They want that time for themselves. And so often that is what, but there's always a discussion in that first appointment about what will our communication point be? How frequently are we going to touch in? So with teenagers, it's usually less frequent. With little ones, the way we see it in our office is that there's some process involved, and there's that, private processing where kids can feel and express things differently one-on-one with their counselor. But because we are in our office, we are primarily what's called attachment focused, which just means that relationships are really, really important, especially parent-child relationships. We try to involve the parents as much as possible. And so we do a lot of check-ins with the parents and talking with the parents while giving that appropriate autonomy and privacy. Now, what all counselors will do, if you have a child under the age of 18, if your child has demonstrated or communicated to their counselor that they are suicidal or that they are going to harm themselves, others, or if they are being harmed, then parents will be informed. And like every Texan, we also have a duty to report child abuse or neglect, and those are called limits to the confidentiality, and that happens, and it's all discussed in that first intake session.
When I love what you said, that it is developmentally different and it's developmentally appropriate that a teenager is going to want their autonomy to talk to a counselor and doesn't want mom or dad to have a running transcript of it, that they're not going to be as honest probably. What do you do? Because I get this question sometimes too about, well, my child said they won't go. They're really struggling, but they just say they're not going to go to an appointment. And do you have an approach of how y'all handle that or suggestions for parents of what they should do?
It's tricky, right? It's really, really tricky because one thing that doesn't work is forcing someone into something they don't want to do. So first of all, let me just say, this is what we're used to. This is a really common issue, is that people come in and someone has resistance to counseling. And a huge part of our job is called building rapport, which means connecting with people in a relationship quickly. And that is and what's really cool is that the number one factor in kind of an effective counseling outcome is relationship. So you've got professional relationship builders whenever you see a counselor. That's their job, is to build that rapport, that relationship, and that trust very quickly. What we try to do is it's usually a parent who wants to bring in a child and the child's resistant. Most of the time, the parent session is first, and if there's a resistant child, sometimes that's just the necessity of how it needs to be if it's a teenager. So we'll talk about it, and it might be that there's some work with the parent about connecting with their child. So we can work through the parent on ways that they can build healthier relationships and tools that they can have in the household. If it's something where we really want to have the child come in, no one's going to force any. I mean, that nobody's forced into anything. We'd encourage, just give it a try. And usually coming first time, when you get to know a person, the fear goes away, because a lot of what we do is we build that stories in our head about an old man that's going to make you lay down on a couch and psychoanalyze you and this and that. and it feels really scary, but it ends up being something that actually feels comfortable and it may be a little usually fun.
Well, I like what you said too about that sometimes it's work with the parents too, that when a child or a teen comes to counseling, it's a whole family experience. It's not just my child's broken, you fix them. It's how do we all support, how do we all learn here, and how do we grow together? Even if my child's the one in therapy, me as the parent, I'm going to learn some new stuff too that maybe I can approach my child differently.
Yeah, and that really comes from having more of a system, looking at the system of the family in ways that we support. Because you can, I don't know, the way I the way I see it is you can have a teapot boiling and you can release the steam, press the little thing, release the steam. But if you don't remove it from the heat, it's just going to build right back up. And that's what happens sometimes if we work with one person in that system and they get a little bit of the steam released whenever they come to counseling, but they're not being removed from the fire. There's still arguments at home or other issues start popping up that create stress. So we want to help real healing, and often that's the whole system involved.
Absolutely. Well, just wondering, do you have any other words you want to give or think about, like as we're trying to like reduce the stigma about families or people getting mental health services from professionals?
Yeah, I mean, I think that, one of the things that, at least for me, growing up, it was encoded in me that there was maybe something wrong if you went to see a professional for mental health support. And that can just sort of pull ourselves up by our bootstraps and we can, push through and here's the thing. As far as I know, we have one life to live. And you waste a lot of time being held back by anxiety or stress and destroy a family and relationship and create we could be repeating patterns and not even realize it, the same thing we're trying to avoid, and we don't even see it. Taking the time to invest in your mental health can be life-giving, not just life-changing, but life-giving. And often we wouldn't hesitate to go to the doctor for help if we had an ear infection or if we weren't feeling well or running a fever or anything like that, or just to get a checkup. As a matter of fact, we go for well check. Your mental health, like your physical health, needs well check and it needs support. And a professional can give such great advice because they are not in that situation. And so, if you're fearful of that, know that as a mental health professional myself, I have to take care of my mental health, just like doctors have to take care of their physical health. So it's not a those people kind of issue. It's all of us have mental health issues, just like we all have physical health issues that we need to take care of.
I love that. Well, we are so thankful you took time to remotely join us today and really appreciate you helping us lower that stigma, help sort of demystify what it's like to going to see a counselor and realizing there's normal people who are counselors out there. Nothing scary about it. So thank you so much and have a great day.
Thank you so much. I really enjoyed it. It's good to see you. Thank you, Dr. Grosso.